Dave Mehmet, it's always great to see you. You're at the cutting edge of a company that actually, literally, when you took it over, I felt was a little bit cats and dogs. But now you are addressing the major issues of our time. I don't want to just limit to RSV. You've got what I regard as being a strategy for the prevention and treatment of diseases that we've had nothing for.
Well, hi, Jim, first of all, and thank you so much for having me on today. I'm sure an exciting day and an exciting time for the industry and certainly, as you say, for GSK. I mean, we have been through quite a radical transformation as a company over the last 5 years. We're now a pure-play biopharma, and as you said, absolutely after the major demerger of Haleon, and absolutely resolutely focused on getting ahead of disease, literally by preventing it and treating it. And that is really taking advantage of this explosion in technologies, new vaccines technologies that we've seen, of course mRNA, but also adjuvant technologies and new emerging technologies, which we think will contribute later in the decade, but also this great phenomena of adult vaccination. Preventing disease is always better, or intervening earlier in disease, but preventing it before it starts is always better for individual patients, for the heavy burden on healthcare budgets, but also systems and keeping people out of hospitals. I think the CDC says that there are 1 million hospitalizations in America alone from vaccine-preventable diseases. Now, the world has woken up to the importance of vaccination hugely and, you know, the responsibilities of it as well over the last few years. And it was really interesting to hear the comments just now on how important the retailer is to the sort of provision of vaccination as well. There are diseases that have not had any vaccine solution ever, and RSV is one of them. Many have been working on trying to find a solution to RSV for 50 years. And now, and we're not the only ones to come forward, but we were the first to publish results, which we're really excited about. We have a great vaccine candidate for this disease that unfortunately 15,000 Americans die from every year, 175,000 hospitalizations every year from RSV. And we have a vaccine where we are seeing, for those that need it most, so that is those with comorbidities, the over 60s, which represent 94% of these hospitalizations, we have a vaccine with data that has 94%, coincidentally, efficacy and protection. So we were absolutely delighted that in a recent AdCom we got a unanimous view on the efficacy for this vaccine, and we're really looking forward, hopefully in a month or so, to getting it approved and being able to bring it not only to the US, although it will be the US first, but also around the world. You know, there are over 1 billion over 60s worldwide. The demographics are only heading in one direction, and just it's another great building block to our vaccine portfolio, building on Shingrix, adding RSV. Of course, we have future vaccines with our recent Affinivax acquisition in pneumococcal, and then further opportunities in mRNA as well. So very important, very exciting times, and you know, looking forward to partnering with the healthcare system and the retailers to bring it to the people that need it.
Well, let's talk about that, Emma. One of the things that I find again and again in your business is awareness. I mean, for instance, I have friends who have shingles. They don't know about Shingrix. Yeah. They will not know about your new vaccine. What about this gap between how evolutionary to revolutionary you've become and the system itself, which is simply evolutionary and doesn't even know about these things?
Well, it's a great point, because if I mean, you know, 1 in 3 of us will get shingles, extremely painful, and that's why, you know, our business grew. We had a record year last year, over £3 billion worth of business, and we still expect to keep growing very strongly with Shingrix again this year and for the years ahead. 3 years ago, if you'd have asked the general public, you know, have you heard of RSV? What is RSV? I think people would have really struggled to be aware of it. But just this last season, You heard a lot more public information, actually, about a triple-demic, a triple season through the winter, whether that be ongoing COVID, obviously flu, but also RSV, and actually awareness now. Which is really good to hear. Awareness now is up at over 50% in many parts of the general public, also with prescribers very importantly, and with pharmacists in retail. So we are seeing that growing right now. Magic Johnson is out communicating on a general disease awareness campaign to sideline RSV. So I think this is something we're very thoughtful about, but also communicating with responsibility and transparency on, the efficacy and the data on the vaccine too. So, where you're absolutely right is in many ways, vaccination is a consumer product. So we need to make sure that we communicate very clearly on the benefits that can come from, stopping these diseases before they start.
Well, in this way, I thought that COVID was actually, don't ever want to equate money with disease, but it was a boon for you. I found out about Shingrix because I went to get my COVID vaccine. And my CVS practitioner said, "Where are you with Shingrix?" And until then, I just said, well, I don't know. I hear about it. I guess it's good. I mean, you've gotten people into the drugstores. They're now part of your effort to make it so more people live.
Well, that's absolutely right. And actually, it's interesting, and we have published some data that if you have suffered from COVID, your propensity with a weakened immune system to actually develop shingles goes up. But I think what's key in this is exactly the point you just referred to, which is whether it be because the general public has got used to and understands the benefits of vaccination, or frankly, the retailers have set up the systems and the data to access patients, but particularly traffic in their stores, is really important to continue to protect the general public and keep them out of hospital, both for the associated costs, but also the burden of disease that can develop too. So lots of opportunity ahead. Jim, I think in the developed world, it's only 3% of healthcare budgets, that are spent on preventing disease. The emergence of new technologies in vaccination is so exciting, and there is a tremendous amount of opportunity ahead when you think about demographics and the enormous capital allocation that goes behind healthcare. The opportunity we have to innovate here. And that's one of the great things also to see in the recent IRA regulation. This is an area where the copay for vaccination was removed. So essentially, at the point of distribution, people don't have any disincentive about worrying about whether they can afford to protect themselves for seniors. So great opportunities here, and I really think that the science and the innovation, as always in our industry, and the technology are all going to help to bring more solutions forward.
All right, before we get to the exciting reinvention of Glaxo, I do want to address something. I'm always looking to China now for where things can go wrong, frankly, and there's people are testing positive for influenza right now. Hospitals across the country jumped to 53.2% in the week of March 12th, more than 70 times higher than just 5 weeks ago. It's H1N1, but it's also H3N2. Can we look to Glaxo to help us in what be the next epidemic?
Well, it's a very important question, and I think the world has reflected hard on what we got right and, what opportunities there are to do better, not just individually, but collectively for the next epidemic. And I think the industry stepped up in very meaningful ways, whether it be in vaccination or indeed in treatments. Certainly we have an approved vaccine now, but we did also contribute meaningfully in terms of antibody treatments for those that weren't able to be protected in time. I think we have an absolutely fundamental responsibility, and not just within the industry, but as we saw amongst governments, regulators, partners, to really make sure that we respond at pace And we are very thoughtful and indeed, extremely engaged and quite formally on next pandemic preparedness. So not only in terms of innovation coming through, but the equity of the distribution of that innovation works well.
All right, before you came on, we were talking about the idea of the Silicon Valley Bank, but really just that's the micro. The macro is that there are a lot of companies that have not been able to get funding that are doing very exciting things. One of the things that's been, I'd say, very much part of your realm is to find hard-to-beat diseases, then look at the companies that are private, that may not have enough money, scoop them up, and then really turn them into franchises. You've been doing that. I mean, I remember when you did it for ovarian cancer. How's that going? Yeah.
Well, great. I mean, this is a really important point, and I know that's going to be a very exciting topic for the full-day session. More than half of the innovation in the sector comes from outside big pharma, and all of us, more and more, are continuing to bring in and supplement our pipelines with business development. And, there are still plenty of opportunities to do that. That was one of the things we tuned up and turned on much more aggressively, as you said, when we started in this big turnaround and step change in performance for GSK, which we're delighted to see is really delivering now. Great year last year, another strong year of guidance this year, and very confident in our 5-year outlook, in part because we've been able to supplement both our organic progress in the pipeline, but also with some partner deals, whether that be in Tesaro, as you said, in ovarian cancer with Zejula, but also we had some great data come through on Jemperli. In fact, we just in endometrial cancer just yesterday that we announced, and that's a really nasty, I think it's the leading gynecological cancer for women, 400,000 new diagnoses every year, and no new great treatments there for many decades, actually, beyond the standard of care with chemo, and now some exciting indications there. That's also building on the rectal data we had before, and also some lung data as well. So, that's been making really nice progress. But also last year, two other really important bolt-ons we did. Affinivax, I mentioned earlier, a very exciting new vaccines technology for pneumococcal disease. That's the second biggest vaccine market, actually, after COVID today, and we think we may have something that will give broader coverage for later in the decade, but a really sizable opportunity there. We also bought Sierra Oncology, which we'll hopefully be launching momelotinib, which is for myelofibrosis, quite a rare blood cancer, later this year. We're looking forward to making progress on that. And one of the main reasons, Jim, for doing the demerger that we did with Haleon was to be able to create all this extra capacity to invest in partnerships or M&A, and really delighted to continue to pursue that. Very pleased with the progress we're making overall on the launches that we have upcoming, but there's always more to do. Patients are waiting. And it's absolutely the core of what we're here for, is to continue to develop and strengthen our pipeline. And there is no debate that is our #1 priority.
Well, one of the incredible things when I look at your portfolio, Emma, is I see diseases that you work on. Meningitis. I mean, some people think that's cured. Well, you got to get a meningitis vaccine when you go to college. HIV. I think a lot of people feel that's over. No. And you continue to innovate on diseases that we thought we beat.
Well, I mean, meningitis, again, we just published our, sounds like the alphabet, but our MenABCWY data hit 11 primary endpoints on meningitis. And as you say, it's a terrible disease with quite a high infection rate, low penetration of vaccination. I think it's about 30%, and yet 1 in 10 people that will get, and children or teenagers mainly that catch meningitis, 1 in 10 will die from it, and often in really brutal, like 24 hours. This is one that always marks me, because I remember there was a girl I was at high school with who very sadly, and this is obviously many decades ago, but died in her first year in college. And there is a reasonably simple solution to this, which is vaccination. Some countries have very formal rules on it, but there's a big opportunity here now. We have broader sero coverage, and we're excited about bringing that forward. HIV, I'm so glad that you raised, because this is far from over as an agenda. Wonderful to see the US government particularly so committed to ending HIV, and amazing to see how innovation across our sector has truly transformed this from a death sentence to being something that you can live with your full life. I'm very proud of how we have pioneered in innovation in HIV many times, whether we're the first integrase inhibitor coming through with 2 drug regimens with Dovato, which is continuing to grow extremely strongly into a blockbuster, but perhaps most excitingly, more recently, pioneering in this long-acting injectable, where we're 5 years ahead of the competition, both in treatments, but also we have a prevention injection, so people can get, instead of 365 pills a year, you are getting an injection 6 times a year. For treatment, and we just published data that proves very comfortably parity performance against pills and great protection, but significantly more both convenience but also discretion, which still matters to a lot of patients. But there's new innovation coming through. We're looking forward to getting to long acting, potentially self-administration long acting, and next year hopefully we'll be able to update people more on how we're making progress on that for later in the decade. But there's still a lot of work to do, and I'm going to say, particularly in the US, we don't have enough patients with virus fully under control. So, excited about the opportunity that the innovation can bring there in a class which, fortunately is protected, where we have a fantastically active patient body.
Well, one of the things I love about your administration of the company, you're not afraid to fail. I mean, you're taking on things like UTI. Now, everyone knows that there's been resistance, okay? The bacteria is beating us.
Yeah.
People know that. We think that the bacteria, that frankly there's resistance, and the community resistance can't be beaten. Not you. You say, you know what? This is an illness that millions of people suffer for. I'm not going to just say, hey, listen, we lost this battle. I'm going to go take it on.
Well, this is a great topic, and a lot of people, this is really foundationally important, Jim. A lot of people refer to AMR, antimicrobial resistance, as the slow pandemic. If the world does not develop new and effective antibiotics, the assessments are that 10 million people a year will be dying by 2050. And from diseases now that we are really used to treating with antibiotics, but where resistance is building. So we were absolutely delighted, whether that be in our homegrown, home-developed, organically developed portfolio with gepotidacin. That's hopefully going to be a new and exciting launch for a very common problem of UTIs, urinary tract infections, where resistance can be quite high, and we think it's going to be hopefully the first new antibiotic for many decades in this disease, which will help address this. And we stopped that clinical trial for efficacy a bit early, but also we've done some BD. Again, you referred to it earlier for a new asset for more complicated infections, and we continue to be very thoughtful about investment here. The age-old challenge is, how do you do this in a way that's going to be economically viable? And we've done this by really being forensic about picking the assets, thinking about the patient groups, where we can make a genuinely appealing return, but also, frankly, fulfill what in our sector continues to matter, which is this responsibility to broader society to solve these problems that have enormous scale, and where innovation is going to be absolutely key. And of course, I keep coming back to it, don't underestimate the importance of vaccination in actually foundationally addressing the core of this whole AMR agenda as well. It really matters, and actually the industry has stepped up more broadly. I think GSK is well recognised for leading in lots of ways in pipeline here, but the whole industry has stepped up, and we've been part of the fund that's been established to try and support more innovation together on this. We also need regulation and the buyer environment and the payer environment to recognise some different models here. And there are some good discussions going on that, and I hope we can make progress on it in the US as well, eventually with the Pasteur Act.
Well, I'm so glad you want to leave it like that, because I want to wrap things up with a kind of more of a philosophical question. Before COVID, I think there were a lot of people in our country who felt that drug companies were rapacious companies, that what they were about was raising prices. Ever since COVID, I think we realized that drug companies are probably one of the greatest forces for medical and social change and for having people live longer. Do you think that this sea change can stay with us? Because I know you and I are business people. Now, you are in the business of saving lives. I'm in the business of trying to pick stocks. But what's happened, I think, is you're the good guys. I think that's changed.
Well, I think it's really important that people understand the deep challenge involved in vaccine and drug development. And I don't, you know, I can't think, I mean, 99.9% of the people involved in our industry are motivated by the impact, the positive impact that innovation can have. And patients are waiting. I mean, there are still so many cancers that don't have, serious and complete solutions. 1 in 3 of us, and it'll probably get to 1 in 2 as the population ages, is going to be facing into some kind of neurodegeneration. Infectious diseases are this permanent threat, you refer to them. And the single best solution to that is innovation from our industry. And it is super high risk, it takes a long time, and it costs a lot of money. And to be able to digest that, it's not just a question of the P&L. And, by the way, rightly, we have the patent cliff model, which means we have to replace ourselves every decade, so to secure access. So there's no generics market without an innovation market. And it is really important, whether it be in US industry or at global scale, that we continue to support the innovators with recognition of the importance, the value creation. I mean, again, think about the value creation from keeping somebody out of hospital with a simple vaccine. So the value creation that comes, and an understanding of the challenges involved and the economics required to cover for that cost of failure. And I think all of that said, being clear and simple on the communication of what we do, and responsible in the way we do it, and if things go wrong, responding to that quickly, being responsible in our pricing and caring about access continues to drive this social contract that our industry has with broader society and all those that fund our work. So, I don't think there has ever been a more exciting time to be in the sector. I think it is the golden age of biology and technology. I think distribution is changing radically, and it's a great privilege and tremendous responsibility as well to be part of all of it.